Hello. So very nice to see all of you today with my colleagues Pierre and Rita. We are asked a lot what Microsoft is doing in healthcare, and that's a very large question. You did have a start of an answer this morning with Philippe Limantour, who talked about what we're doing in pharma industry. So now we propose to focus this session on healthcare providers and understand how we can valorize the data and how AI can improve operationally the healthcare for different healthcare workers and can improve the patient output. I would like to start with a question to Pierre, CTO, to understand how we can valorize the data in healthcare.
Thank you, Ingrid. So all AI story starts with data. So the all beginning for probably all presentations today. And in this area of generative, the data is very important. Why? Because the data will be processed differently, like something request from the database or something like that. So why it's very different today with AI generative? It's probably and technically it's because the data it's understanding by the models. So in this and with these technologies, it's very important to have specific and manage the access of the data. I can give you a very simple example. If you want to request about a patient, for example, if we don't have access to the data of the patients, we can have the result behind the AI generative information you don't have access behind. And that is very important to understand that because if we don't manage very carefully the data front of the AI generatives, it's very important. The second part is not managed here. It's about the data for training models. Today, it's much more managed by the models creators, and probably it's not needs to speak about that. But behind that, a lot of questions is behind the copyright and so on. But directly with the healthcare, we can manage differently. But just want to focus today on the data front of the AI generatives. Last week, we announced some data. I don't know if you can move on the presentations. So it's okay. It's your slide. So I have just a small example here when we speak about what is the understanding behind the AI generatives. For example, here about the lions heard from all around. The questions we can ask to the model, it's very important again to understand because the answer, the idea is not to have the information about the lion for Wikipedia, for example, much more a lion around the sound it can make. And that is exactly the semantics proximity we can use by the AI generatives. And specifically around the health data, you can find the semantic proximity and not directly the indexations for the data. If you have, for example, again, index the patient's data. Around the announcement, last week we announced a specific data platform related to the health with 4 big pillars. The one it's about the data request is not only needs to be hosted on Azure. You can request the data outside the Microsoft platforms, and that is a big announcement because we know a lot of data is not only on the one platform, it's much more the hybrid scenarios and architecture. And with the Microsoft Fabric, we can request this data where they are. The second point, it's about the security access, because again, linked to to the health ecosystems, we need to have a very secure access point about the data. And the third is about the tooling, because we know about, again, the health, we need to have some specific services like anonymation, and processing, ER processing to train the model and make some specific data analyst. And the last one, it's about the Copilot, because we announced a lot of Copilots linked to the collaboration staff and links to the developer and data scientist and data analyst. So we announced a Copilot for Data Fabrics to manage the data on these platforms. And we announced also, and we pass the speak to you, Rita, about the Copilot on Nuance to help the health ecosystems with the Nuance applications.
Thank you, Pierre. Good afternoon, everyone. Happy to be among you today. I think I won't take a lot of risk if I say that each one of us has been a patient at least once in his life. And you should know that being a patient can be a stressful experience. When you get to see your doctor, when you get into the hospital, what you expect is that everything goes well, you will be reassured, people will take care of you, the staff will be there for you, adjust for you, because this is about your health. This is the most important asset that we all have. But what we don't see as patients is what happens in the backstage. What happens in the backstage is we did a study a few years ago about the burden of documentation within the hospitals in France. 67% of the clinical staff mentioned that they have experienced work exhaustion situation, or call it burnout. Of the 67% clinical staff, 3 out of 4 has said that clinical documentation, administrative work is the main source of their burnout and their exhaustion. So I just let you make the calculation here. So that's what the Dragon Medical One is about. I think some of you may know what Dragon is. Dragon Medical One is using conversational AI in order to enable the physicians to capture time, to spend more time with the patients. So we're giving time to the physicians in order to focus on what matters most, which is our health. So using conversational AI, the physician will be able, with an intuitive way, using the voice, navigate into the EMR, do the documentation workflow, input all the report, sign off. So all that repetitive tasks, which are just about documentation, are all managed by voice. This is empowering the clinicians, again, into getting more time with their patients so that when you leave the encounter, when you leave the hospital, you are reassured, you had your story told with the physician, and you get the time that you need in order to get healthier. So let's get to the next step now. So what we have observed with Dragon Medical One, this is the data that we capture and that we analyze and we have from the different sites where we have Dragon Medical One deployed. So thanks to Dragon today, we can give between 1 and 2 hours a day to the physician. Again, I let you do the math, but you can just see that in the situation of physicians and clinical staff shortage, that our hospitals or even in the private clinics that we have today, this is really important, and this is a return on investment which is very important and very high to the hospitals. 1 to 2 hours a day, that's more than 50% time that we're given to the physician on admin and documentation. That's the time that he'll spend speaking to the patient. That's the time that he'll spend into focusing on what needs to be done, what's the care plan, what are the next steps, and giving the patient the time that he needs to be reassured and to get the best experience possible. Dragon Medical One is not just another Siri or another NLP solution. Dragon Medical One is 99 accuracy. We have expertise in the medical ground that leads us to that 99% accuracy, and I can tell you that a physician if you give him or her a solution that doesn't work and he needs to get all the time to the keyboard in order to complete and correct the documentation, he will not use it. On the lettre de liaison, I think a lot of us know that since 2017, there has been a decree that makes the lettre de liaison a requirement for the hospitals. Basically, the lettre de liaison, for those who don't know, is a document that tracks the full care plan since the admission to the hospital until the patient is discharged. And the requirement is that that lettre de liaison should be delivered the day that the patient leaves the hospital. And on the same day, it should be shared with his treating physician, médecin généraliste, or médecin traitant. So with Dragon Medical One, and I can tell you the lettre de liaison is a lot of information. If the patient has been in the hospital multiple days, there are a lot of information there. So if the patient can leave with the lettre de liaison, that's great. He knows what needs to happen next. He can schedule the next radiology exam or lab test, etc. He can get back to his physician, family physician, and share that information so that it can be tracked and know what needs to happen next. So again, this is where we're giving more assurance to the patient about the continuity of care that we're delivering. Now, what we're doing right now, so Dragon Medical One is a solution that we have since multiple years on the French market. Right now, we're moving to the next stage. Let me ask you just a simple question. Did it ever happen to you that you go to the physician or to the radiology, you get your exam, you get your report, you read the report, and there are technical medical words that you just don't understand, so you jump to the conclusion just to see if everything is okay or if something is problematic. I see a few people here smiling today. It happened to me. It happens a lot of time. So with conversational AI combined with ambient AI, combined with generative AI, these are use cases that we can solve today. So you go and you see the physician, and just using his voice, the physician says, give me a summary for my patient. Give me a summary for a patient of 15 years old. I mean, even a 15 years old can understand what's written. Or you are abroad on vacation for professional matters. It happens that you need to go to the hospital. You see a foreign physician in Italy, in Spain, in Germany, anywhere else. When you leave the hospital, you would like to have a letter which is in French, so that when you get back to France, you can give it to your physician, médecin traitant, and have it added to your medical history. So the physician just needs to say, translate for a French doctor, and then the report is translated, and you can go with your French, and even if the doctor doesn't speak French, it's not a problem. So these are just small cases, small use cases and examples of the many other examples that we can have if we combine conversational AI with Gen AI, etc., on an infrastructure that Pierre has mentioned, which is secure, etc. I'm sure that as a patient, no one of us will be happy if someday we wake up and our report is just on the internet. I think nobody will appreciate that situation. So that's what we're ensuring with platforms and working all together within Microsoft. So that's basically what the Dragon is about, making our healthcare system smoother, giving back time to the physicians so that they can have an easier life, and at the end, giving the patients a better care experience. And that's AI for health. I'll give it back to Ingrid now. Thank you for listening.
Thank you, Rita. So that was a great example of how we can serve at the best the practitioner and how it benefits the patients as well. And I would like to build on it with a few use cases. But before, I will make a short disclaimer. That is that Microsoft is a tech company and is not a healthcare company. So I will talk about example that will be about the EMR, etc. But we are not building an EMR. We are not building a huge platform for patient, or this is not something that Microsoft itself will put on the market. What we do is we understand what is the sense of the direction of the healthcare transformation, and we build the technical capabilities so to enable it and to accelerate it. So now about what are the real short-term ambition we do have. And we have this expression, I'm just borrowing it from my MD friends. They're like, we want to be freed from keyboards. And everything that you said, Rita, is really about that. It's about the MD spending time during the consultation taking care of the patient and not just taking notes. And outside of the consultation, having a lot of time reduced on the reformatting of the information. We can go a bit further on this first use cases, talking about the burden of the time that is spent putting multiple times passwords into the different interface, or the difficulty one could have going from one software to another. And actually, your solution already allows MDs to navigate between windows with just the voice. We can use generative AI as well to prepare for the consultation with interrogation of the patient data. We can have some notification when something new happens. We can use it to find the codes for the reimbursement and reduce the workload of typing information in all of the different databases. So these are the first part, like just free MDs from the keyboards. But we can imagine exactly the same kind of scenarios for nurses. Like that goes from room to computer to get the information, to record it, to check what the MDs have been saying or what are the instructions in the scheduling system. So this as well with generative AI would free them from the keyboards. The second type of use cases is about how can we empower healthcare workers to deliver a better care. And for that, you can imagine a clinician in a consultation that can be augmented with analysis of the prescription and identification of potential drug interaction, or use of patient digital twin to have a personalized prescription and drug dosage according to the characteristics of the patient. We can use some tools to have some recommendation on compliance or the best medical path according to the symptoms. They can also, if required, be connected with the different clinical trial that would be suitable for the patient or the key experts that would help solve the issue. And one last thing that is actually very important as well for the healthcare system is about efficiency and how we can first reduce the burden of scheduling with AI and automation, how we can use some patient scoring to improve the patient flow as well. So these are some examples that are enabled by generative AI, only if we trust it. And I had this great question, Pierre, but I don't know if I'm going to ask it if you had just 1 minute. But the question was, and Pierre will be here.
The regulation, it's probably the key of success of IA in health. And probably in France, we are very lucky to have a good regulations behind that, and we announced we are very happy to contribute in these regulations on this IA by delivering Microsoft expertise, tooling, and the processing behind these regulations, because it's not easy to do that, specifically in health, and we are very happy to contribute on it, and I hope we can do it together.
without question.